Assalamualaikum viewers and welcome back to our channel BioDenver's Hub. Today in the playlist of oral and maxillofacial surgery, we will be continuing the same prevention and management of extraction complication. In that regard, our today's video will be about the soft tissue injuries. So first of all, we will be discussing some causes for it, that due to which causes the soft tissue injuries they are likely to occur. First of all, the surgeon lacks of attention to the delicate nature of mucosa. Secondly, any surgery that is performed with the inadequate access, that can be due to the inadequately sized envelope flap that is being created. Thirdly, any rushing during the surgery can also result in the soft tissue injuries. And at last, any excessive and uncontrolled forces that are applied during the surgeries through the instruments can also result in the soft tissue injuries. So these were some causes. Now we will be discussing different types of soft tissue injuries. So first of all, we will be discussing the tear of mucosal flap, which is the most common soft tissue injuries that can occur. So what are the causes for it? First of all, inadequately sized envelope flap that results in the inadequate access can also lead to the tear of mucosal flap. Then forceful retraction of the flap beyond the ability of the tissue to be stretched. If you are reflecting it or retracting it so much forcefully that it exceeds the ability of the tissue to get stretched, it will definitely result in the tear of the mucosal flap. Now we will be discussing some preventions. So first of all, you need to create an adequately sized flap in order to prevent the tension on it. Then using the controlled amount of force, you need to reflect it. Thirdly, if there is the inadequate access, if you are facing a problem regarding the access, you need to go for the releasing incision wherever indicated, because the releasing incision, they will give you the increased amount of access. Now, if the tear of mucosal flap has occurred, what will be the management? You need to reposition the flap once the surgery is completed. But if it was a hard tissue surgery, then it should be stopped for lengthening of the incision in order to gain the better access. And wherever indicated, you need to give the releasing incision as well, if the tear is indicated or detected in the beginning. Now, there is another situation. If the tear is jagged, you need to excise the thrown edges to create a smooth margin for closure. It should be done cautiously because it can cause the closure of the wound under the tension. It can also cause the wound dehiscence, and it could also compromise the amount of attached gingiva that is adjacent to the tooth. So this was about the tear of mucosal flap. Now we will be studying another type of soft tissue injury, that is the puncture wound. So what are the causes for the puncture wound? Uncontrolled forces that are applied through the instrument during the surgery can result in the puncture force that will lead to the puncturing of the soft tissue that was present or you were operating in that field. So in that regard, there will be a puncture wound that will be created out there. After that, any instruments such as the elevators, periosteal elevators, they may slip from the surgeon hand, and it can cause the puncturing of the soft tissue, resulting in the wound. Now, how can we prevent this type of injury? First of all, we need to use the controlled amount of forces. Secondly, we need to use the finger rest, the support from the opposite hand, if the slippage is anticipated. Now, if the puncture wound has occurred, so what will be the management? In that case, first of all, you need to prevent the infection to occur out there. Or if there is excessive bleeding, you need to apply the pressure packs over it until the bleeding stops. And when the bleeding stops, you need to remain that wound open, because if it is a small infection, this open space, it will act as a drainage path for that wound. And usually the healing, it occurs by the secondary intention in that case. So now we will be discussing another type of soft tissue injury, that is the stretch or abrasion. Abrasion, it represents the combination of heat damage and friction. So now what is the most common site of occurrence of this injury? It includes the lips, the corner of the mouth, the flaps, and the skin. So what are the causes? First of all, the rotating shank of the burr rubbing on the soft tissue, it can most often lead into the stretch or abrasion injury. After that, the metal retractor coming in direct contact with the soft tissue can also result in the stretch or abrasion injury. Now, if the stretch or abrasion injury have occurred, what will be the management protocol for it? First of all, for oral mucosa, we will be discussing it. We need to keep the area clean, regular oral rinsing, so By following these measures, it will heal within this 4 to 7 days. Now, if this stretch or abrasion injury has occurred on the skin, so we need to keep that area moist. We need to cover it with the ointment, that is the antibiotic ointment, to prevent the delayed healing and scar formation out there. So in the skin, the healing will occur within 5 to 10 days. So this was all about the soft tissue injuries. I hope this video will be helpful for you all. Don't forget to subscribe to my channel and also click on the bell icon so you will get notified about our future videos and updates. Thank you.